What new targeted therapies exist for chondrosarcoma genetic types? Imagine a rare bone cancer that develops from cartilage cells and resists traditional treatments like chemotherapy and radiation. That's chondrosarcoma, a challenging tumor to treat, especially because it often doesn't respond well to standard therapies. But recent advances in understanding its genetic makeup are opening new doors. Scientists are now focusing on specific molecular targets within these tumors, aiming to develop treatments tailored to each tumor's unique genetic profile. Targeted therapy is a way to attack cancer more precisely. Instead of affecting all rapidly dividing cells like chemotherapy, targeted drugs interfere with specific molecules involved in tumor growth. For chondrosarcoma, researchers are especially interested in genetic mutations that drive the cancer's development. By blocking these pathways, they hope to slow or stop tumor progression. One of the most common genetic changes in conventional chondrosarcoma involves mutations in the genes called IDH1 and IDH2. These mutations change how cells process certain chemicals, contributing to cancer growth. Drugs that inhibit these mutated enzymes are being studied. For example, ivosidenib targets IDH1 mutations and has already been approved for some blood cancers. Clinical trials are now exploring its use in patients with chondrosarcoma harboring IDH1 mutations. Similarly, IDH2 inhibitors are also under investigation. While these drugs are not yet standard treatment, they show promise for a subset of patients with specific genetic changes. Immunotherapy is another area of interest. It works by boosting the immune system to recognize and attack cancer cells. Drugs like nivolumab and pembrolizumab, which block the PD-1 immune checkpoint, have shown limited success so far in chondrosarcoma. Some patients with dedifferentiated chondrosarcoma have responded, but overall response rates are low. Researchers are exploring combinations of immunotherapy with other targeted treatments to improve outcomes, but more studies are needed. Another promising approach involves drugs that inhibit angiogenesis, the process of new blood vessel formation that tumors relying on for nutrients. Medications like anletinib and regorafenib are being tested in clinical trials, especially for advanced or unresectable tumors. Early results suggest they might help slow tumor growth, but more evidence is necessary before they become routine options. Researchers are also investigating drugs that target the cell cycle, such as CDK4/6 inhibitors. Abemaciclib is one such drug being evaluated in clinical trials. While preclinical studies are encouraging, we still need more data to confirm its effectiveness in patients. Beyond these, scientists are exploring other pathways involved in tumor growth, like the pi3 degrees Kelvin AKT mTOR pathway. Laboratory studies suggest that natural compounds may influence these pathways, but these findings are still preliminary and have not led to approved treatments. It's important to remember that most of these targeted therapies are still experimental and available mainly through clinical trials. Genetic testing of the tumor is essential to identify patients who might benefit from these treatments. Since chondrosarcoma is rare and genetically diverse, personalized treatment plans based on each tumor's genetic profile are becoming increasingly important. While these new therapies are promising, they are not yet universally available or proven to work for everyone. Surgery remains the main treatment for most cases. Patients should discuss all options with their healthcare team, including participation in clinical trials, to access the latest advances. Looking ahead, ongoing research aims to expand the range of targeted therapies and improve their effectiveness. As scientists learn more about the genetic drivers of chondrosarcoma, more precise and effective treatments are likely to emerge. For now, genetic testing and personalized medicine are key to optimizing care. If you or someone you know is dealing with this rare cancer, consulting specialists familiar with the latest research can make a significant difference. Remember, every tumor is unique, and treatment should always be tailored to the individual's specific genetic makeup.